Hi, I'm Dr. Hart, and if you're like me, the first time you were introduced to kinesio tape, or KT tape, was during the Summer Olympics with Misty May, trainer, and Carrie Welsh Jenners as far as the Women's Olympics volleyball. And we all saw the tape there and we wondered, what is that there for? What does it do? Well, since then, we've learned a lot about as far as how KT tape, and the brand that we use here is Rock Tape, but they're very similar. They all do kind of the same thing, and it's to look at improving performance, helping recovery, and aiding and healing. So today we're going to talk a little bit about how we use tape here in the office, how it helps us support as far as our chiropractic adjustments and our massage therapy to help support that area that we're working on. Today we're going to be talking about the shoulder. So we're going to be looking at as far as putting some tape here on the shoulder, but also the shoulder and the neck are connected, so we need to work on supporting the neck as well. So we're going to go over some taping techniques and how we do that and what it's doing.
I'm going to start with the shoulder here, and this is to help stabilize it mostly. So this first piece is going to anchor at the top of the shoulder. And I'm going to have you bring your arm forward, just kind of like that. You always want to stretch the body part rather than stretch the tape. So I'm going to anchor it at the top here. And I'm going to go around the deltoid here and then finish it off at the bottom of the deltoid. And then we're going to do that along the front as well. And it's time to stretch the skin instead. I'm going to have you bring your arm back, like behind you. There you go. Thank you. Same thing, anchor at the top. The tape is okay to overlap a little bit. And then I'm going to bring it around the front of the deltoid here. To meet at the bottom of the delt. Then you really want to make sure you're rubbing on the tape at the end to activate the adhesiveness, and also so the tape pulls the skin from the underlying tissues. There you go, you can leave them home.
It feels good.
Yeah, it looks great. Well, and that's what, so just like Kim was saying, we're looking to stabilize this joint. We're helping with circulation. The other thing we're doing, the third component that's most important, is we're actually stimulating some of the neurology of the underlying tissues here, which really helps activate those areas.
Again, you want to stretch the body rather than stretch the tape on this. For the postural taping, we're going to start from the bottom and work our way up. You want to go on either side of the spine here. Make sure the hair doesn't get in it. It's going to be uncomfortable otherwise. So we're going to go right up to the base of the head there, where the hairline starts.
The biggest things to look for with the tape, and the reason why we stretch the body and not the tape, is that when you're stretching that, the tape has quite a bit of elasticity to it. So if you put too much stretch in the tape, it can actually irritate the tissue a little bit. So that's where kind of the most common thing where you'll see if somebody's having a bad reaction to the tape, it's not that they're actually having an allergic reaction to the adhesive, it's just that there's too much stretch there and it's actually irritating the tissue. So that's why you want to stretch the body and really just let the tape lay over that area that's already been stretched.
The idea behind this one too is just to help, you can kind of go back to, is to pull her back to neutral where everything's supposed to be aligned.
On the posture, helping stabilize the neck, because a lot of our shoulder injuries that we see actually aren't so much the shoulder, it's actually coming from the neck and the upper back posture that's putting the shoulder into a bad mechanical position. The shoulder's not moving properly, so they're helping with the tape to help work on that posture, stabilize the shoulder to help get us a better correction.
Anytime you do a decompression strip, you do want to have a little bit of stretch. You're going to split it in the middle instead and just stretch the tape at about 50%. So you start in the middle and then bring it out to the sides on this one. Really making sure you're activating this so that the skin is pulling away from those other underlying tissues. Helps improve the blood flow and lymphatic flow as well.
Perfect. Great job, Kim. Thank you. Looks terrific. How's it feel?
Feels good.
Thank you.